Hi, I'm Brandy Christensen. I am currently in Professor Lee's Structure and Function of the Human Body course at Rasmussen College. I will be discussing dissociative identity disorder. The objectives to this PowerPoint is to identify the pathogen and the cause of it, identifying the symptoms seen within the condition, understanding what goes along with each personality, identifying what organs are affected by this disorder, comparing and contrasting the hippocampus and amygdala, understanding the treatments for the pathogen, identifying ways to prevent this disorder from happening and ways to help the earlier stages, and understanding the long-term and short-term consequences and risks. As many people might know, everyone has their own personalities and their own way of doing things. Now, what if someone has more than one identity? Some people might think of this as kind of confusing. Dissociative identity disorder is exactly that. It's a mental disorder that interferes with memory, perception, identity, and awareness. DID is caused from severe and repeated trauma through natural disasters, sexual, emotional, or physical abuse, or any extreme events in young children. As these children grow up, they will suppress their memories, feelings, and thoughts to cope with the situation. And as adults, they believe that the events that happened to a different individual. And with this disorder, it causes interruption with relationships, friendships, family, and through work. Signs and symptoms along with DID include a person feeling possessed by other identities or feeling unattached from oneself. Normally, they'll develop anxiety, depression, and suicidal thoughts with this disorder. They'll have an inability to remember people, events, or time periods, and this can include important areas within someone's life and even surroundings. Personalities and identities that go along with DID will have their own gender, characteristics, voice, personal history, and physical qualities such as eye wearing eyeglasses or not. Some other examples can be facial expressions when communicating with one another, or hand gestures, or even the laugh can be changed as well. These personalities may not know each other, so the main individual won't know that their body is being possessed by, for instance, a younger girl, an older man. It can be a variety of different people. The main organ being affected within DID is the brain. And within the brain, there's the limbic system that contains the two parts associated with DID, which is the hippocampus and the amygdala. The hippocampus is related with learning, memory, and stress, and the amygdala is responsible for emotions, memories, and survival instincts. I found a research article that called Hippocampal and Amygdalar Volumes in Dissociative Identity Disorder. And as I was reading, I found out people with DID have 19.2 smaller hippocampuses and 31.6% smaller amygdalas compared to healthy subjects. The main treatment for DID is psychotherapy, talking with a psychologist about problems in the disorder, and counseling helps find the cause of the disorder so the psychologist can help talk you through it. The medications that can be taken with DID is antidepressants, anti-anxiety, and antipsychotic medications. These don't fix DID, but they can help the side effects of them. Some ways to prevent DID is to seek out help as soon as problems are arising, such as sexual abuse or verbal abuse. Just reaching out to friends, doctors, or faith communities can help talk about situations and get the problems recovered as soon as possible so the disorder doesn't develop later on in life. Short-term effects with DID include suicidal thoughts and attempts, self-injury, drug or substance abuse, and violence. The long-term effect for DID is having this disorder for the rest of your life, and with this you can develop different conditions such as anxiety, depression, post-traumatic stress, sleeping disorders, eating disorders, and even develop severe headaches. To wrap things up, I found a couple facts that go along with DID. Females are one-third more frequently diagnosed than males. Females have more personalities, such as 15 different identities. It can even exceed more than 15. and males can average around 8 personalities and even could be more than that. Now that we have gone through all the objectives, we should be able to identify the pathogen and the cause of it, identify the symptoms seen within the condition, understanding what goes along with each personality and traits, identify what organs are affected by this disorder, being able to compare and contrast the hippocampus and amygdala when associating them with this condition, being able to understand the treatments and preventions for this disorder, and knowing the long-term and short-term consequences and risks. Thank you for taking the time to understand dissociative identity disorder.